But some of these bacteria can cause medical conditions such as atherosclerosis, cardiovascular disease, dementia, Alzheimer's, diabetes, pregnancy complications, and so on and so forth. Hello, this is Dr. Aryani again. In our comprehensive evaluation, if I see that one of the things that we check definitely is the condition of the gum. So we do something called a periodontal evaluation. We do the measurement of the pocketings, and if I see any sign and symptoms of gum disease such as bleeding, puffy gum, or swelling, then the next thing is we need to know what type of bacteria that cause this inflammation, because some of these bacteria inside our mouth, not all of them, we don't want to eradicate all of the bacteria inside our mouth. That's not homeostasis, okay? But some of these bacteria can cause and also contributing factor towards some other medical conditions such as atherosclerosis, cardiovascular disease, dementia, Alzheimer's, diabetes, pregnancy complications, and so on and so forth. So it's very imperative for us to identify the 5 bacteria. Now there are actually there's about 14 types of bacteria that cause this gum disease, but 5 of them is considered high risks because their ability to transfer their DNA toward the other 9 bacteria, and these 9 bacteria that's supposed to be just commensal bacteria or low profile bacteria, they're acting the same thing like this high risk 5 pathogens, such as that's how we only test on this 5 right here, okay, which is AA bacteria, PG, FN, TD, and TF, okay. And this is so easy, okay, it's non-invasive. Usually we just open this package right here, and then if you see there's this line right here, okay, that's where we're going to collect the bacteria. So I mean the saliva, I'm sorry. So you just spit right here, spit, and then stop around this red line right here. We don't want to have a frothy one. We want to have a solid saliva. The frothy one, if we still have the frothy one along this line, we just keep giving the saliva until the solid one is in this line right here, okay. So number 1, before we do the saliva test, we want to make sure that half hour before you don't smoke, brush your teeth, or using any mouth rinses products, or eat or drink. So half hour before. After half hour, we can just go ahead, take this information. Take the saliva tests, and then after that, we put your name, your code right here, and then send it to the lab, and within 2 days or so we will find out the result of the bacterial infection that you have, how many types you have among those 5, how many types you have, 1, 2, 3, or 4, and how many of them for each of the bacteria. From that profile, then we're going to customize your treatment plan as far as to try to overcome this bacteria. So if you ever notice that your gum is bleeding gum is not normal, even though just a little bit. The same thing like, if you brush your skin and then it bleeds, is it normal? No, it's not. So the same thing with our teeth. If we even floss a little bit and there is bleeding, that means that's not normal. That means the possibility of gum or bone infection around your gum, and it has systemic implication as well. So have that checked, tested, and we'll take care of this. If you have any question, please give me a call at 610-664-1641, then Presidential Holistic Dentistry. Thank you.